Urinary tract infections are a worrisome public health care concern. It is a public health problem that affects both males and females. Females are more susceptible to urinary tract infections due to the difference in their urogenital, reproductive anatomy, physiology, and lifestyle. UTIs can lead to hospital admissions. UTIs are the most common bacterial infection affecting geriatric patients and represents the second cause of hospital admission in older adults. The urinary tract infections prevalence is common in women of all ages, older men, and uncircumcised males. The incidence of UTI is alarming. Urinary tract infections affect different parts of the urinary tract system. The urinary tract infection is a common infection that can infect any part of the urinary system or the tubes through which urine exits the body, such as the kidneys, ureters, bladder, and urethra. The urinary tract infection affects the lower urinary tract, which is caused mostly by E. coli. Different types of organisms can cause urinary tract infections, such as Klebsiella, Staphylococcus, Proteus mirabilis, and Enterococcus faecalis. In children, the cause of UTI in neonates is Klebsiella, and in boys is Proteus. UTI diagnosis is when the number of causative agents or pathogens increase above 10,000 mL in a urine culture or urinalysis. Bactrim or nitrofurantoin are empirical treatments for uncomplicated urinary tract infections. Trimethoprim, sulfamethoxazole, and nitrofurantoin are affordable and less expensive than others. Patients that are allergic to Bactrim or nitrofurantoin can be given amoxicillin clavulanate or Augmentin. But Augmentin cannot be used as a first-line treatment because the E. coli organism is resistant to it. Augmentin is also beneficial to treat asymptomatic bacteriuria and urinary tract infections during pregnancy. If urinary tract empirical treatment fails after 3 doses, a urine culture will help the provider make the best treatment decision. It's necessary to do a urine culture after treatment to verify if the antibiotic worked. Patients on nitrofurantoin or macrobid will require periodic evaluation of their pulmonary function to rule out fibrosis and peripheral neuropathy. It's essential to monitor patients on nitrofurantoin's chronic therapy for candida. It's vital to monitor the use of nitrofurantoin with patients with anemia, diabetes, electrolyte imbalance, renal impairment, vitamin B deficiency, and debilitating diseases. Periodic urinalysis tests for crystalluria or urinary calculi formation is essential for patients on sulfonamides. It's also crucial to know that AIDS patients can develop adverse effects with sulfonamides. All sulfonamides interact with cyclosporin, hydantoins, methotrexate, indomethacin, thiazide diuretics, and warfarin or Coumadin. It should be noted that antibiotics generally increase the patient's INR level, which means they will bleed more easily. Trimethoprim interacts with ACE inhibitors and ARBs. Nitrofurantoin interacts with anticholinergics, probenecin drugs, and magnesium salts. Important ways to manage side effects or avoid them is to avoid sunlight due to photosensitivity with sulfa medications. If a rash develops, the patient should be advised to call their primary care physician or healthcare provider and discontinue use immediately. Report intolerable GI upset to healthcare provider. Sometimes the antibiotic can be changed. Also, yeast infections can be sometimes avoided by taking a probiotic while taking the antibiotics. The drug of choice for urinary tract infection is trimethoprim and sulfamethoxazole, also known as Bactrim, and also nitrofurantoin. Bactrim should be ordered 160 milligrams / 800 milligrams twice a day for 3 days for patients diagnosed with a urinary tract infection. For children greater than 2 years old, 6 to 12 milligrams of trimethoprim / 30 to 60 milligrams of sulfamethoxazole per milligram per kilogram per day in 2 divided doses for 10 days should be ordered. If nitrofurantoin is prescribed, it generally is 100 milligram capsules 4 times a day with meals for adults. For children, 5 to 7 milligrams per kilogram per day in 4 divided doses for at least 7 days. Drug selection rationale. Bactrim and nitrofurantoin are effective drugs in the first-line treatment for UTIs. Sulfonamides and trimethoprim are affordable and cost-effective medications for urinary tract infections. Nitrofurantoin is also beneficial for patients that are allergic to sulfa or Bactrim medications. Nurse practitioners and providers need to educate patients to practice proper health habits like good personal hygiene, drinking plenty of water to flush out bacteria out of the urinary tract, and to empty the bladder. It's also necessary to educate patients to wear cotton undergarments. Females should wipe from front to back after urination so as to not introduce bacteria into the urinary tract. And females should change sanitary pads frequently during menstruation. Providers should also do a physical exam of the patients to identify the urinary tract infection symptoms, such as dysuria and high body temperature. It's crucial for providers to do a urinalysis and a urine culture for appropriate and successful urinary tract infection treatment to improve patient care outcomes.